Talk to me about the serious concerns that you and other people have outlined in this letter today. What are they?
The concern is that this bill will harm more people than it will help. It doesn't help patients. They're not really safeguards. They're just vague qualifying conditions that are in the bill. You cannot predict how long someone has to live. We know that about 1 in 5 people, the diagnosis is actually, there's an error in it. And the big problem is coercion. And we know that the way the bill is set up, this is not going to detect coercion and coercive control. For families, the first that they may know that their relative has gone down the route of taking lethal drugs is when they get a phone call to say, could they collect the body? There's no requirement for the family to be involved. The judge has been removed and the panel only have to hear from one doctor and from the patient, but they've got no powers to ask questions or to go into anything in depth. And the only doctor on the panel is the psychiatrist. And we know the College of Psychiatrists have come out against it. And I've heard, and this is on the grapevine, so I haven't seen it in writing yet, that it looks as if the College of Physicians are also going to say that this bill is not safe enough. This bill has got too many loopholes in it.
Well, we wait for official word from the College of Physicians. You mentioned coercion there, and another signatory to the letter, Professor Colin Rees, was interviewed by our health correspondent Arsha Joshi in the report that was on just before we got the chance to speak. And he said coercion, as you said, is very hard to spot, yet it's being used as a major argument in your letter. Just how big a problem do you think this would be?
I think coercion is a huge problem. Families may be exhausted with caring for somebody. They may want their hands on their inheritance. They may be fed up with paying for care costs that they have to pay for. But the problem is, too, that we as healthcare professionals can think about the number of times we've been taken in. We thought it was a loving family, and it turns out that they weren't at all. And they'd persuaded someone to change their will, write out their natural children and leave it to whoever's the new partner.
You've seen this firsthand?
Yes, I've seen it firsthand. I've been taken in. The hospice that I've set up and ran for many decades, the whole hospice was taken in on several occasions by families that we really thought were loving families. And then we discovered that either the life insurance policy had expired or that the will had been changed. The families wanted their hands on the inheritance.